Today, there are 46.8 million people living with dementia. If dementia were a country, it would be 28th in the world, equivalent to the population of South Africa. By 2050, this will be 131 million people living with dementia, mainly due to the demographic ageing of our population. Every day, it seems, we are confronted with these negative news stories, terms such as the grey tsunami and the dementia epidemic, and the portrayal of people living with dementia as sufferers are filling us with fear. An analysis of public discourse around dementia and ageing tells us we're actually fearful of two main things. Firstly, we fear the economic costs. We constantly tell ourselves the story that we can't afford to get old. We worry about such a substantial proportion of our population not contributing to our tax base, and we worry about the increasing rates and costs of hospitalisation, of aged community care, and of residential aged care. The second thing we fear is the personal cost. Dementia has replaced cancer as our most feared disease. We associate it with a loss of control and a loss of autonomy. And none of us want to age with fear. We all want to age with good care and with control over our lives. Our research and international research suggests that this narrative is actually leading to fear and social exclusion of our ageing population and of people who are living with dementia. Our research in Australia shows that 20% of our adult population would not expect to have a meaningful conversation with people with dementia. Over half of the Australian adults that we surveyed said that if they were themselves diagnosed with dementia, they would feel ashamed, depressed, and humiliated. And more than 10% said they wouldn't want their family or friends to know. We have to change this narrative. We have to somehow move from a fear of ageing and dementia to actually embrace what is a story of success. Population ageing itself is a story of our successes, of our improvement and our capacity to improve standards of living globally and to create critical gains in public health. So how do we get and move from a fear of ageing and dementia to get serious about building on our successes and reducing this fear and stigmatisation? Well, the first thing we need to do is get serious about research. If we take a case study of infectious disease, we see critical interventions and critical discoveries such as immunisation and antibiotics that actually changed our life expectancy very quickly in a very short space of time. But we see at the moment a critical disparity in funding for dementia research when we compare it to other chronic conditions. Let's take cancer. In the UK, cancer research receives 13 times the amount of funding as dementia does, despite the fact that dementia is actually much more costly to our society. The situation is similar in Australia and the US. So firstly, if we're going to get serious about success as it relates to dementia, we need to get serious about funding for dementia research. But science is not the only thing that will save us. Let's think again about infectious disease and take our inspiration from John Snow, who back in the 1850s discovered that cholera, another infectious disease, was actually sourced in our town water supply. Now, we would think that we would celebrate such a discovery, but John Snow was not popular. He went to the centre of our communities, right to the water pump in the central districts of London, and pulled the handle off the water supply, and within a week ended a cholera epidemic. The consequences for the society at that time were quite significant. to actually change the delivery of public infrastructure, the delivery of services, and the way we live together. So I would argue if we're going to get serious about dementia, we can't leave it to science. We can't lead it just to medical. We need to reframe dementia as a social challenge. And we need to actually begin to see the creation of dementia-friendly communities and age-friendly communities as everybody's business. So what else do we need to get serious about? The World Health Organization tells us we need to commit to getting serious about the structures we build in our societies. We need to create and develop cities and communities that create outdoor spaces and buildings that are accessible and promoting of health. We need to invest in good public pavements, public toilets, pedestrian crossings, green spaces, places to rest, and address the physical access problems to buildings that still exist across the world. We need to get serious about affordable, accessible, and secure housing. We need to design our housing using aged and dementia-friendly design principles. We know from the research how to build these types of structures, but our town planners need to make these kinds of designs actually mandatory. Good age-friendly and dementia design should not be the exception, it should be the rule. Secondly, we need to get serious about our services, and I'll start by talking about health and community services. We need to actually invest in creating and promoting healthy lifestyles, into risk reduction. We know if we can promote physical activity levels and improve diets, we can actually reduce the number of people that will go on to develop dementia in their older age. We know that the same types of interventions actually work to reduce the impact for those who are already living with dementia, and yet we continue to medicalise dementia and ageing as if it is a problem that can be solved by a pill. We need to seriously invest in re-ablement and rehabilitation for older people and people with dementia, rather than accepting their disability as the status quo associated with their condition. The research is quite clear. We can re-able and rehabilitate even those with the most advanced dementia. Ultimately, what I'm saying is we actually need to get serious about the type of society we want to live with and live in. We need to promote respect and social inclusion for older people and people with dementia. We need to recognise their capacities and their resources to promote full and active, engaged citizenship. We need to invest in transport, public transport, community-supported transport, driving competence for older people. We need to invest in parking and situations that allow people to continue to participate in our civic spaces and societies. We have to change the commercial sector, the marketplace, the places where many of us participate. And I've been very lucky to be able to participate in a community in Kiama in New South Wales where we've had genuine civic engagement with our Chamber of Commerce and our shops. We've been able to change and create more dementia-friendly and age-friendly services in a library, a community college, a pharmacy, and in our cafes, through looking at the way these spaces have been designed, through engaging staff in education, and for looking at the way that forms and processes work to facilitate the better engagement of older people with dementia. And we've been able to do that because we've done it in partnership with people with dementia. They have told us the places and spaces that need to be changed to make their lives better. We have listened to their stories and they have led the way for us. We need to get serious about solidarity in working with older people and people with dementia, rather than talking about them as if they were the other. So finally, this is about getting serious about stories, about changing the public discourse about ageing and dementia from suffering to success. We need to reduce the stigma associated with ageing and living with dementia. So I'm going to finish today where we started, with a story, but this time a positive one. Kate Swaffer was diagnosed with dementia at age 48. Last week, Kate celebrated with other influential women in Australia because she was nominated as one of our 100 women of influence. Kate's work was recognised as the CEO and co-founder of Dementia Alliance International, an advocacy organisation run by people with dementia for people with dementia, who are known for advocating around and highlighting the human rights issues faced by many people living with dementia globally. Being diagnosed with dementia at 48 must have required an enormous amount of reframing from Kate about how she was going to live her life and live well with dementia. Today, I would like to encourage you to learn those lessons and to take your inspiration from Kate, to reframe dementia not as something to be feared, but as something that should motivate us all to a collective effort to reduce the impact and to create a better society. For ultimately, a dementia-friendly community will be a community which is friendlier to us all. Thank you.